Hi, everybody. This is Dr. Roya from Canada. This program is from the Medical Fire Nova, and it's about the common diseases and their treatments with the Ayurvedic medicine. I've been practicing in Canada for about 24 years, family medicine, and in the past 15 years, I have been studying the Ayurvedic medicine, and I have been practicing some part of that in my practice for the people who don't want to take medication for some of the common ailments. I also, because did my medicine from India, I have been familiar with the Ayurvedic medicine as well as the homeopathic medicine, and I studied homeopathic medicine also later on. So the topic for today is going to be constipation and the common things that I use for constipation before people go into other medication. For those who do not want to go on other medication, we start them with these, and usually this responds really, really well. And you could try these methods and see if they would be helpful to you. Now, the way we do that, it's some of them is a change in the diet, and then there's of course exercise, which is walking. Walking is really important for constipation. It's to move the bowel so that the food in the bowel can actually get down and out of the body. For that, it is really important to have movement. And because most of the job these days is to be sitting down, then it's really, really important that one walks. And now some of my patients come and tell me that their job is heavy and they lift and all those kind of things. Again, that lifting doesn't translate into walking, because if you're standing in one place and you're lifting it the whole time, putting it up and down, still you're not walking. So it's not really, even though it's an exercise, it's not the exercise you want for constipation. So that's really important. Now, the definition of constipation. Constipation is when you are actually having a hard bowel movement. So some people have soft bowel movement, but they have it every third day or every fourth day. You still do not call that constipation. Constipation is, by definition, it's a hard stool. It's something that you're working hard to pass the stool. And so it's really important. So even if you go one day, like 3 times, but all of this hard, you're still constipated. So you don't have to not go for it to be a constipation. Most of the people have this misunderstanding that constipation means you don't go. And that's not the correct terminology. So the number one thing in the diet that has got to change is the way you drink water. You got to drink at least 3 glasses of water per day, if not more. Then this water could be with a little bit of a pink salt if you can, and be lime. So that would be a better choice. Now, the temperature of the water is important. If it's room temperature or if it's body temperature, then it's great. If it's hot or if it's cold, it doesn't really agree with the body, and that's what the Ayurvedic medicine is. Usually they work with a room temperature or body temperature. Now, the water should be away from the food, which means that at least half an hour before or half an hour after, at least. The reason being that the water can dilute the acid in the stomach, so it harms or it prevents the better digestion in the stomach, which is not your plan, basically, in a treatment for constipation. So the next thing is chewing the food, which is really, really important. Normally, 32 times you've got to chew a food before you swallow it down, to increase the workload of the mouth and reduce the workload of your stomach in digesting the food. So when you make it into smaller pieces, and it's easier for the stomach to digest it with the acid and all, and then it makes it easier for the bowel to work it out. So I wouldn't expect you to do 32 times, but at least 23 times would be a good idea, or 20 times at least would be a good idea to chew your food, really. So give yourself time to chew your food. And again, if you can avoid it completely, avoid having water with your food. But if you can't, then you should add a little bit of lime to your water so that it can digest better. Now, the common things that I would suggest to my patient is green leafy vegetables. Anything from kale to spinach to leek to any of the herbs any of these vegetables, they would work as long as you cook them at least for 5 minutes. And when I say cook, I don't mean baking in the thing and drying them out. So it's got to be with water or steam, so that it keeps the moisture and it becomes better to absorb, first of all, the vitamins, and also it's better for the stomach to help the digestion. The second thing would be, so the vegetables is one thing, then the fruits. In the fruits, there are some things that would help you get rid of constipation, and that is pear, watermelon, and prunes. Prunes, if they are fresh or they are dried, you can soak them overnight. Usually, I would say 3 prunes, but if you think that you're having a diarrhea afterward, then you make it less, about 2 or 1, depending on what you need. But it's got to be overnight soaked, and then in the morning you chew the prune and make sure that you drink the water as well. So that's really important. The pear and watermelon actually do help, and kiwi. Kiwi is another fruit that helps with the digestion as well. The other thing is a type of food, like stews and soups, they really help much better. And ginger, if you make a tea with ginger, that also really helps. Just the hot water, and grate some ginger and throw it in the water, and that is what you want to drink. Usually you should do it first thing in the morning or last thing at night, or before meal, at least half an hour before meal. That's really important. You have to have at least 2 servings of the vegetables per day, and you have to chew it really well, as well as you have to make sure that it's cooked with water or steamed so that it doesn't lose the moisture. The things which are fried or baked, they don't have the same kind of action. Then there are hemp seed and flaxseed. Hemp seed has got omega 3 and 6. Flaxseed has got omega 6. If you put about teaspoon of them, one of each every alternate day. So you don't have to take both. You take one of them, but on alternate days, or 2-3 days of this and 2-3 days of that. So something that it's not very similar, so that the brain cannot just predict it. And that would really help with your digestion as well. But it's got to be with water, and make sure it's grounded. If it's not ground, it is not going to help you as much. So those are the 2 other good things. Then there is the metamucil at the end. If none of these things works, then the metamucil would be something that you can get over the counter, and it's got fiber. But I'm sure one of these things would help you, and you don't have to get to that. And of course, after metamucil, if it doesn't work, you go to see your doctor for that. Now, there are 3 things that you have to avoid in the food. One is yogurt, banana, and rice. There are the 3 things that make you more constipated. So if you have diarrhea, you could use them, but if you have constipation, avoid them. Cow products in general, they have got more inflammatory substance in them, and as a result, they would cause more constipation. So if you can avoid cow product, whether it's milk, whether it's yogurt, whether it is the meat of it, try to avoid that. And you can use any of the other things. The only thing that I do suggest to people is that for men and boys, not to use soya, because it's got estrogen and you don't want that as a substitute to the milk of the cow. The walking we have already discussed, and that's really, really important for this. The other thing is that I would suggest that after 5 or at the maximum 7 p.m., try not to eat anything anymore. And that is really, really important, so that your body has time to digest all the things that it's had, and not to overload it with food. If you really have to eat something and you're a snacker, then I would suggest some cucumber or celery sticks. Those are really good stuff that you can do. There are also smoothies that you can use. Like you can use a mixture of, if one of the 2 fruits per day that I usually suggest to my patients, I would say that take any of the fruits like orange, apple, whatever, and you mix it with, or any of the fruit that I just mentioned, like pear, kiwi, watermelon. And when I say watermelon, I mean the size of your fist. And you just need the fist size fruits You don't take the whole watermelon and think of it as a one fruit. So you can mix that with some of your vegetables, and if you can make a smoothie out of that, that would be also another good way of getting the constipation treated. However, again, remember the vegetables, I always suggest that at least cook it for about 5 minutes. I hope this works for you. And let me know in your comments if it's working for you. And if there's a problem, let me know. And then I could respond to that. I hope you have a wonderful day. And I hope this worked for you. Have a wonderful day.